Welcome back to Hardball. President Obama is going to speak to the nation and to the United States Congress in joint session next Wednesday night in prime time. His topic, health care. Today, Vice President Biden offered this preview of the coming speech.
With regard to the question of whether or not, or what the health care system is going to look like that we're going to get, stay tuned for Wednesday. One thing I've learned, don't step on your boss's lines. There's going to be a major speech laying out in understandable, clear terms what our administration wants to happen with regard to health care and what we're going to push for specifically. It's going to be an awful lot of screaming and hollering before we get there, but I believe we're going to get there.
Will the president offer understandable, clear terms to shift the health care debate back in his favor? Can President Obama unite enough Democrats to support what he wants? And with us now, Democratic Congresswoman Jan Schakowsky of Illinois and Republican Congressman Chris Smith of New Jersey. You two are very civilized people. I'm looking forward to a very civilized discussion. Although, Chris Smith, you're going to vote against no matter what this guy puts forward. There's not a chance in a zillion you're voting for this guy's bill. But let's talk about this substance. Ms. Schakowsky, Congresswoman, do you think you could possibly vote for a bill that comes back from House Senate conference, a compromise that included some other way to monitor, regulate, tax, control the insurance industry to keep them honest and offering accessible, affordable health care without having a public option? Is there any other way to bring the insurance companies into line with the public interest? Any other way to do it?
I'm one of many Democrats in the House who believes that in order to really break the stranglehold that the insurance industry has had on our health care, denying coverage, denying care, that the best way to do it is to have a public option and it would also control costs. I believe at the end of the day, Chris, that because it's the best way, not ideologically, or politically, but it's the best way, that we're going to have that at the end of the day.
Well, the problem, you, Congressman, you're a conservative Republican from the Northeast. So you're not that conservative. Do you think that a public option ends up being single payer eventually?
Oh, I think it's inevitable.
Isn't that the game?
Many people, including Barack Obama and others, have said we may not get there right away, but we are on a mission to get there over 5 years. When did he say that? He said that. I watched it on YouTube, and
oh, wow,
it was a speech he made. Jan has suggested that You think Barack Obama is a secret believer in single payer? Not secret. I think he has put it in plain view. People have not focused upon it. And I think what's going to happen this coming week, frankly, is that all of what has happened so far in the House and the Senate
so you think he's a secret national health care policy
I think he wants it. He has said as much.
Let me ask the Congressman, are you ideally suited to someone who, are you secretly a believer in national health care where the government basically runs the national health care system and there's no insurance companies involved? Is that your ideal?
No, well, that is irrelevant. What I believe is that the insurance companies.
Because I'm asking.
Okay,
is that your ideal?
I think a single payer would be a good idea, but that's not where we're going, and that's not what the president wants to do, and that is not what this is going to lead to. If the insurance companies are willing to change their ways, they are willing to compete, they will be able to survive just fine. They may not have to make such high profits, or their CEOs may have to cut back by a few $1 million, but I think they will absolutely be able to compete, and lots of people will continue to choose them.
The polling shows, despite the president's not great handling of this, to put it lightly, he hasn't been clear, he hasn't been strong, he hasn't made it clear what he thinks the country needs since the election. But the polling still shows an overwhelming percentage of American people don't like the way things are right now. They want a national health care plan that fixes the problems of portability of pre-existing conditions, and they do want the people who aren't covered. And the question is, are we better off, Congressman Smith, are the Republicans believing the country's going to be satisfied with a complete blowout here? In other words, comes Christmas time, Thanksgiving, nothing gets done. The president goes down in defeat like Hillary and Bill Clinton did. Is that good for the country? Total defeat of the Democrats?
We need to have a bipartisan plan.
Is that good for the country? Total defeat.
If it's a bad plan, hopefully that is the outcome. We need a good plan. Jan Schakowsky said on April 18th, and I watched her speech, a man told her that the public option puts private insurance out of business. And she goes, he was right. There's no doubt, and it'll happen.
Let me check on that. Is that what you said, Congressman? Did you say it's good that the public option puts the private out of business?
No, actually, the man next to me said that it may be hard to compete. That is not what that gentleman said, and that is not what I believe. But I didn't take an oath to protect the profits of the insurance industry. Yeah. I think we have set up a system where they can compete if they want to, and they don't have to go out of business. But they are going to have to change their ways. They have a stranglehold right now, and millions of people are left out of the system because of them.
Chris, what we need now, Barack Obama will come in as if he's been apart from this process. Nothing could be further from the truth. We know Rahm Emanuel and his whole White House has been engaged.
Do you think Rahm Emanuel has been advocating a particular plan?
Oh, I think the intricacies of this, of course he has been. This has not happened in a vacuum.
Okay, here's my option. I want to ask you, Congressman Schakowsky, you vote on the House. You're a very impressive member, so let me ask you the question. If you had to choose in the end between a bill or no bill, what's better?
I don't think that I have to choose, but I do believe we will have a bill. Don't underestimate Barack Obama. He may be reaching out to the Republicans, but he has a steely spine. We're going to get a bill. It's going to be a good bill, and I think with a public option. Will
the House pass a bill before the Senate does? Will the House pass a bill before the President says he's for a public option? What do you folks need to pass a bill with your majority in the House?
Well,
what do you need for him to say to get it passed?
I think, as Nancy Pelosi said, that we're going to pass a bill and it's going to have a public option, and I think it would be good for the momentum of the whole bill for us to pass it right away as soon as.
And you don't expect. In other words, your party is not saying in the House, Madam Speaker is not saying wait till the Senate acts. You're willing to act first.
That's my thought. I believe that's true, yes.
Okay, thank you. Let me get to you.
Thank you, Chris. First of all, Americans are awakening to what this bill will actually do. They will be forced to become part of health care. They have to do it or else they get hit with a 2% tax. Employers
I support that.
Okay, well, I don't.
I think every grown-up ought to be responsible for their health care.
Will be forced. It's all about forced. To force this, force that.
We have to have car insurance to drive on the highway. I can't get on the Jersey Turnpike. I can't get on the Jersey Turnpike and the Garden State Pike without insurance.
Okay, you're asking me questions. I'm trying to answer. The Health Care Advisory Committee will say what the parameters are for health care. Rationing is a very real concern. Factcheck.org found that the president was mistaken. Hopefully, he wasn't deceiving by design, but was mistaken when he said that abortion will not be covered. It is covered in both the premiums that will be paid when people get these affordability credits or premium subsidies, and it will be in the public option as well.
We will see more abortion. True.
Then check factcheck.org.
It is just
they are
not
a nonpartisan.
Okay. Is there a fact difference here? Do you argue, Ms. Schakowsky, Congresswoman, that abortion services will not be subsidized in any way by this bill?
That's exactly right. Government funds, taxpayer dollars will not go to fund abortions. Okay. It'll all be private dollars.
Okay, here's my problem.
That's not true.
You guys, every time, you men and women on the Republican side, and you're right to your conservative views, obviously it's part of the American debate, every time there are Democrats move to do something on health care, you say, well, there's a better alternative. It's a Republican alternative.
Well,
it usually means tax cuts. You haven't done anything since Abe Lincoln to deal with health care. And now you're saying you're going to do something. Why do you always say you're going to do something when the Democrats are in power?
Who created S-chip? The Republicans in 1997, one of the most innovative programs to enfranchise children who don't have health insurance. I have proposed.
I think that was bipartisan.
It was a Republican Congress, and it was signed by President Bush. But you said not since Lincoln.
And a Democratic president.
Yeah, is that right? In 1997. But we were the ones who supported that, and it came out of the controlled House.
So you're saying, Congresswoman, that was initially proposed by a Democratic president?
Are you?
That's exactly right.
Well, let me ask you. We had a Patients' Bill of Rights bill that was pushed. I was one of the co-sponsors of it, which would help. There have been excesses by the insurance companies. No one's going to say that they don't do it right all the time. I actually handled the expenses for my parents. They denied coverage on it numerous times.
Have you ever been to an emergency room? Have you ever sat in an emergency room? Yeah. You know how many people are sitting in there just trying to get basic health care, primary health care, just sitting in a room for hours and hours and hours because they don't have insurance?
You know, Chris, that there are millions of people who could become part of Medicaid and S-chip or aren't aware of their eligibility. We got to enfranchise those people.
Last word, Congresswoman. Last word, Congresswoman. I just wonder what the Democrats. I just want a bill. That's my view. I want a bill.
We are
I want to deal with it.
Go
ahead, Congresswoman.
we're going to get a bill. It's going to be a good bill. And just people should just know they are already paying the average holder of insurance $1,000 a year to pay for people who aren't covered, who aren't insured. We're paying for this system already. Okay. We're paying too much and getting too little. We can do better.
Well, I'll be watching you guys next week as you sit in the House chamber and the president speak. And I'll be waiting to see when you applaud, Congressman. I'm going to see if you ever stand up to applaud anything. I want to see if you applaud anything. Congresswoman Jan Schakowsky of Illinois, U.S. Congressman Chris Smith of New Jersey, the Garden State.